My name is Denise A. Yardley. I'm a senior investigator at the Sarah Cannon Research Institute. So for a person that is now facing a diagnosis of breast cancer, I think the time for optimism is clearly here. When we even look at statistics, it looks like early detection continues now to pick up early stages of breast cancer, and that by far is the greater proportion of our new diagnoses and far less of our more advanced stage 3 patients and even less of our stage 4. If we look to the coming year, it's predicted that almost 240,000 new cases of breast cancer will be diagnosed. I think when we look at statistics and we hear the 1 in 8, which seems to be so prevalent, and we can reach out and touch somebody that's had breast cancer, I think we need to look that really still is a small rate and averages as 12%, so that 88% of women are not being diagnosed with breast cancer, and that number is now really declining. It's paired very nicely with the fact that breast cancer now has fallen as a leading cause of death for women to now the second leading cause, and the estimated deaths in the coming year are now under 40,000. When we look at also genetics, and I think there's a lot of interest and focus in genetics, we're able to actually test and predict certain families that have a very high-risk family tree, suggestive of perhaps a hereditary component, but that still only accounts for 5 to 10%. But we do have a simple blood test that's able to detect that, and we can really instill earlier detection, and there's a lot of progress underway of trying to identify actually a prevention for these patients with the hereditary breast cancer. But for the patient that now has received a diagnosis of breast cancer, I think there's every reason to be very optimistic. Our therapies for these patients, both in the early and advanced stages, are continuing to improve, and I think we clearly look at clinical trials as really being the founder of some of these developments in improving diseases, treatments, and improving outcomes, and that's really resulting in a decline in the death rate, and early detection is declining in the incidence.